Michigan Open was started in an effort to try to improve opioid prescribing in the state of Michigan. And it came about from an observation that many opioid overdoses started off with vulnerable people getting prescribed opioids by dentists and surgeons.
The opioid epidemic is one of the only public health problems that continues to get worse. It's currently estimated that 130 Americans die every day from opioid-related overdose, more than car accidents or gun-related deaths.
Michigan Open is a partnership between key stakeholders that are all some way touched by the opioid epidemic. So that includes surgeons, anesthesiologists, hospital systems, our clinicians at the bedside, and of course, most importantly, our patient partners to try to find innovative solutions to prescribing opioids and managing pain control during surgery.
We do a lot of research. We probably write 20 or 30 papers a year to understand opioid use, misuse, abuse, addiction, and the complexity of that problem. We were able to come up with what we call evidence-based prescribing guidelines. For example, if you have your gallbladder removed, how many pills should you get? The number is 10 pills. And in the state of Michigan, it used to be about 40 pills. We've been able to measure a significant impact. So in Michigan, over the past 2 years, prescribing after surgery is down by over 50%.
There's a natural relationship between the surgical work that Michigan Open has done and dentistry, which is really a surgical field. Dentists actually don't prescribe a lot of opioids. We prescribe about 6% of opioids in this country, but actually we prescribe a lot to certain vulnerable groups. So we are the #1 prescriber to teens and 20-year-olds in this country. And the challenge with this is that frequently those individuals are opioid naive and at much higher risk of misuse and abuse. Dentistry is one of the few professions that has research that shows that ibuprofen and acetaminophen given concurrently is actually more effective than any opioid mix. And so getting the word out about this information is an important part of our strategy.
Even if our opioid prescribing changes, doesn't necessarily change the pain experience that someone has after surgery. So being able to find innovative alternatives to opioids and effective means to care for patients during surgery is absolutely critical.
While the work in Michigan Open is decreasing prescribing after surgery and therefore decreasing the excess number of pills available in the community, we also understand that we have decades of excess prescribing to address. Hence, we've been doing opioid drives throughout our state as a way to get people in the community to give them a resource or an access point to safely dispose of their unused pills without having to worry about access to those facilities or potentially walking in and out of law enforcement sites.
We've changed the way almost every surgeon in our state, and then thousands of surgeons across the country, treat pain after surgery. And that's made lives better.